Okay, Terry Chapman here. I did my presentation on children with autism spectrum disorders. A couple of things is that I spent 5 years as a vocational trainer, so I've worked with a lot of adults and children with autism over time. As I've written in many of my papers, my 3-year-old son is also autistic as well. So this is a subject very near and dear to my heart. So I just want to touch up on a couple of things that were maybe we can use music therapy to specify with children with that have autism spectrum disorder, ASD. Okay, so let's just jump right in. Going too fast, sorry. Okay, so what is autism? Autism is defined by deficits in communication, language, behavior, social skills. Kids with autism will have, a lot of times, autism is really a spectrum, so it can be higher functioning all the way to lower functioning. Kids can, these communication and language things, it causes a lot of problems, like in classrooms, they have problems communicating. Verbal issues a lot of times happen. So, stuff like that. Um, yeah, simple as that. So, okay. How do we understand autism? ASD is commonly understood to be a neurological disorder that involves complex interaction of genetic and environmental interactions. Um, so basically, it just has to do with the brain, the way the brain is wired a certain way. Um, and as far as the causes, generally unknown. Researchers are investigating different roles that as far as like genes, hormones, environment, and as far as autism and spectrum, so we don't really have actual causes. I wouldn't say, but there's research being done to discover what potential causes are, but it's mostly believed that kids are just born with it. Okay, so just to dive down a little bit on some of the symptoms, excuse me, inability to understand, use social skills, interact, and develop age-appropriate relationships. This happens oftentimes in classrooms when we're mainstreaming kids. Um, they'll have lots of behavioral problems, um, have problems communicating with the teacher. They get frustrated, bored easy, stuff like that. They don't have as much interest in things as other people will have. At their age, they don't really have a lot of social interaction. They're not interested in interacting socially with the kids their own age as much. They can be kind of obsessive in some ways. I've seen that. Um, they're they're very much into routine. They don't like change very much. So when you change their environment and stuff like that, it can cause problems. They like to. One of the things I figured out with my son and working with people with autism is basically it's best to always set the agenda straight, explain why you're asking them something. Don't just say do this. Say I need us to do this so we can do this. Give reasoning. Structure is I find is very important. Um, and they do become overly dependent sometimes on routine and repetition. So you don't want to become too dependent on them as well. That's something else too. Um, Simple as that. And a lot of times with their verbal skills, of course, um, they can be misleading with the cues and interactions. A lot of social problems happen with kids with autism. So, okay, so just a few statistics I've decided to put together. Prevalence of children born with ASD in the United States is estimated at around 1 in 59 births. More than 3.5 million Americans live with ASD. Prevalence of children with autism in the United States has increased by 119% in the year from the year 2000 to 2010. That's huge. So basically, I'm not so sure if I agree with that. That people that the idea that we're actually more people have autism. I think we're just doing a better job diagnosing it, and we're figuring out a lot more people have it than we originally thought. Um, And something else I thought was really nice and really important as to why it's important that we diagnose kids at an early age um, is noted that over the cost of lifelong care can be reduced by 2/3 with early diagnosis and intervention. We're making them less dependent on other things. They're becoming more independent as we diagnose them at earlier ages. Which is a good thing. That's why it's very important that we are doing everything we can to make sure we're getting kids diagnosed. A lot of parents sometimes are in denial about whether their kid might be autistic or not. But, oh, my kid's got autism. I went through that myself, and it's a big issue to me. So very important. Okay, so why music therapy? I basically got this quote out of one of the Wheeler ratings. The purpose of music therapy for individuals with ASD is to provide these clients with clinical musical experiences such as improvisation, receptive music, recomposed music, and or songwriting that target core features of autism, relating communicating, socializing, sensory integration, motor functioning, and cognitive functioning. Um, so I think that's a very good working definition or argument as to why music therapy. I also included, they play an important role in individuals with ASD, of course, communication disorders, the pre-verbal communications systems. This framework can allow children a potential for revealing both pre-verbal and alternate communication systems. This results in a lot of times can support and even negate or reverse some of the symptoms of autism. And the way I work point in a different direction. Basically, we're teaching them to deal with their disability in an effective way. Okay. So addressing the communicative and interactive deficits often found in children diagnosed with ASD, songs executed in several ways can help with communication, social interaction. I researched a few things that are useful. There's probably dozens of things, but I just want to touch on a few. Well, there are dozens of things, but call and response songs are really good. Allows the client to respond to certain themes in natural ways. It gets them motivated. So basically, you can just do songs like the hello there, hello there, hello there, how are you, how are you, it's so nice, it's so nice to see. And they just respond. That's one thing. The emotion in music, I think, in my opinion, can help with anxiety as well. Or even that's with anybody really, not just people with autism. Yeah, songs that require fill in the blank. Like bingo, okay, like B, and they say INGO, or they'll just maybe have them say the B, the I, and the G, B, I, G, and the other person would say the other words. So that would be a great example of something used in a therapy session. It keeps them interactive, keeps them going. So I mean, it basically works on multiple things. Okay. All right, so songs that elicit exclamatory behavior. These are phrases that can be helpful with a child who has ASD, who may often have a flatter response. They respond in more dynamic ways with vocal interaction and corresponding more facial expressions. So they're smiling, they're talking on monotone like I do normally, like I'm doing right now. Basically, they're able to talk and with more dynamic and express more emotion, and brings them out in many ways. So another good one. Okay, improvisational experiences. So this is also known as clinical improvisation. These experiences are effective in targeting goals of relatedness, communication, joint attention, social, emotional skills. The therapist generally follows the child's musical lead by spontaneously creating music to engage in the child's musical and non-musical responses. There's several ways you can go about this. You can do something as simple as getting maybe both of you can have like a shaker and have the child kind of lead something with that. I mean, it's kind of all kinds of things you can do with that. Percussive instruments you can use the piano. I did play something improv on piano with different keys while you're playing something, just all kinds of different things with that. It's pretty much endless as far as what we can do. Okay, oops, skipped a couple. But anyway, I included this neat little video. It was basically, I just found it online. It was music therapy and an autism spectrum disorder, which really lines up with what I was doing. I figured I'd share that. Let's see if it plays.
They may experience repetitive language, limited or lack of verbal speech, poor nonverbal conversation skills, and more. In addition, they may have troubles interacting with others, have little interest making new friends, or not knowing how to interact socially. Despite all of this, some may manage to have exceptional abilities in visual, music, and academic skills. In order to cope with some of the challenges that individuals with ASD face, music therapy is a type of relief where music is presented in order to address physical, emotional, cognitive, and social needs of the individual. The music intervention is presented by a credentialed professional who provides the treatment through singing, dancing, listening, or even creating music. Some individuals with autism may try to express themselves through humming, shrieks, and other sounds. And so music therapists work with these sounds using vocal music activities. Examples such as songs with simple words or repetitive phrases and even repetitive nonsense syllables can assist the child's language. Meaningful word phrases and songs presented with visual and tactile cues can facilitate this process even further. Music therapy gives the individual the freedom to discover and express themselves. They can make noise, bang instruments, shout, and as a result, experience the pleasure of emotional satisfaction. One study has shown that music therapy helps individuals living with ASD by improving language comprehension, encouraging the desire to communicate, making creative self-expression possible, reducing non-communicative speech, decreasing echolalia, which is an uncontrolled and instant repetition of the words spoken by another, and lastly, teaching social skills. A recent study done this year has shown that among 364 children aged 4 to 7 years, the mean scores on the Autism Diagnostic Observation Schedule, ADOS, and social affect domain has significantly decreased during the study. This makes music therapy an effective method with deep and consistent effects on improving social skills of children with autism. Music therapy begins with an assessment to determine the goals the individual wishes to achieve. Individuals with ASD are typically referred to build social and transitioning skills, to facilitate self-expression, to facilitate communication, to build vocabulary, and to manage self-harming behaviors. To build social skills, most therapy sessions begin with a greeting song. This song encourages turn-taking, eye contact, singing hello, and singing each other's names. To facilitate self-expression and communication, the music therapy intervention of improvising is used. When improvising, there is no right or wrong. The improvised music is often used as speech, and the music therapist and the client may take turns responding to each other either vocally or by using an instrument. Rachel Finnerty, a registered psychotherapist and accredited music therapist, describes an experience she had while working with a 9-year-old boy with predominantly nonverbal ASD. When we first started, it was difficult to complete a full 30-minute session. He displayed exit-seeking behaviors and was jumping from instrument to instrument. I decided to bring in a music therapy intern to manage his attention while I held the space musically on a piano or guitar. As the routine and expectations became established, he began to spend more time with each instrument and music activity. He has now reached a point where he can self-direct and self-regulate during the sessions. He now sings along to all songs. He participates in music improvisations on the piano and the push bells. He does not seek exit from the room, and we have increased the session time to 45 minutes. All in all, music therapists need to tend to the needs of the individual, which is why music therapy techniques are very flexible. Unlike other therapies, music therapy does not depend upon speech. Since some individuals with ASD have difficulties processing speech, but their ability to interpret music is still intact, music therapy may be more effective than the alternatives.
All right. So interesting as far as that. Kind of sums everything up there. Okay, so my little summary: music therapy is a vital tool when helping children with ASD. It's crucial that we continue to use these strategies and frameworks in treating these individuals during the early years of their lives. This is a very subject very near and dear to my heart, obviously. But yeah, that's basically it. Okay, my references.